We started out Maximus Call and Radio Show 26 talking about the weekly unpopular opinion about how excessive self-improvement can actually be like masturbation, as Tyler Durden in Fight Club called it. And so maybe sometimes you should engage in the contrary, which is self-destruction, or at least destruction of your story or your narrative that you buy into too much. We had some other great questions about what are the benefits of testosterone, especially when it comes to the psychological benefits. We had a question about the benefits of oxytocin, another kind of hormone that's sort of the love or the cuddle hormone. And welcome to Maximus Live number 26. We always take the first couple minutes of the show lately to do what I call the weekly unpopular opinion. And this week's weekly unpopular opinion actually comes from one of my favorite movies of all time, which is Fight Club. There's a great scene in Fight Club where Tyler Durden, sort of the protagonist, antagonist, is talking to his alter ego, and he says that self-improvement is masturbation, but self-destruction, on the other hand, that kind of gets him excited. And it's sort of an interesting quote, and I actually agree with it, even though it's a very sort of contrarian point of view, because nominally you would think that someone who does therapy and obviously has a whole community and company that's around health and performance optimization is really into self-improvement. And I am in some ways, but I think the typical way in which self-improvement is talked about and done is actually harmful to most people, and I will tell you why. So there was a great book that was actually written by this guy named Tony Schwartz. Tony Schwartz, interestingly, wrote Donald Trump's The Art of the Deal, which Donald Trump is famous for, even though he had nothing to do with writing the book, really. He just listened to Trump take calls, and then he wrote a book and made him famous. And Tony felt so guilty, actually, about that, because he was a giant narcissistic blowhard, that he wanted to write a more redeeming book afterwards. And so he wrote a book which was underappreciated. It wasn't as big of a bestseller as Donald Trump's The Art of the Deal, but the subtitle is basically Searching for Meaning in America. And the book is basically a nationwide tour of what was called the New Age movement. So I don't know if some of the people who are listening to this are old enough to even remember that. But there was sort of an interesting cultural shift where in the 1960s and 70s, there was the whole sort of hippie counterculture psychedelic movement that kind of died out in the 1980s because it didn't really change the world, and we became sort of consumed by greed and cocaine and crack and the whole movements of the 80s. But the 80s and I would say particularly the 90s started to move into sort of a different era that was sort of called the New Age, and it was almost like a counterculture 2.0, if you will. And that's when things like meditation and yoga and these sort of alternative health wellness practices, which are now very mainstream, where it's just sort of emerging onto the scene. And there was a big circuit, if you will, of people who were part of that, like the Jack Cornfields of the world, the people who wrote, Chicken Soup for the Soul. All these people were like often like famous authors and speakers, and they literally just travel around the country on the talk circuit. It was almost like the wellness circuit. And they would hold workshops and do book signings and talks. And there was almost a crowd of groupies, if you will, that would go around to these things and follow it. And in some ways, you're like, look, it's a good thing, obviously, to be into your health and wellness. And obviously some of the techniques, I'm a proponent of meditation. Yoga can be very beneficial to some folks. But the way that it was sort of being followed by the adherents, I actually thought was very sort of, psychologically avoidant, if you will. The interesting thing about the book is he spends a chapter focusing on one particular place or practice, right? So he goes to S.A.R.M, for instance, and talks about the whole history of S.A.R M up in Big Sur and the speakers. And the interesting thing is a lot of these people who became gurus, or what we call influencers now, often got into that space out of trauma. Like a great example is Richard Alpert, who was sort of Tim Leary's right-hand man. Who was a big proponent and one of the early advocates for psilocybin magic mushrooms, and in fact was the co-PI on the Harvard psilocybin project. He later, took the point of view that you don't need to do psychedelics, but you can do sort of meditation to get into states of personal growth. But his whole journey into becoming a psychedelic guru and then a meditation guru who wrote the best-selling book Be Here Now, was the fact that he was gay and was in the closet and hadn't come out and hadn't come to terms with that. And so the psychological turmoil that he had, he kind of sublimated and channeled into like personal growth and self-improvement and being a guru, when quite frankly, he should have just gone to therapy and figured out a way of coming out to his friends and family, and went through his sort of journey of transformation of like being a public gay man. And I realized a lot of the gurus, and you see this with all these scandals, right? The guy who popularized Bikram yoga is kind of a sketchy dude, even though you could argue Bikram has some positive health benefits. But I think a lot of the people who get into like the teacher trainings and make yoga kind of their thing and their lifestyle are quite frankly also traumatized, and they're looking for healing, and they delve into self-improvement as a means of avoidance, right? And that's sort of the tragic irony of sort of what I call excessive self-improvement, right? What's happening is you're trying to treat the symptoms of an underlying problem, whether that's trauma, or you feel like you aren't worthy, or you didn't get what you received as an early child or in your adolescence, and you get into self-improvement as a way of addressing that. And that may be conscious. You may be aware of those traumas and you're like, okay, this is the way that I find that I'm trying to fix it. Or you may not be aware of those traumas and you're just kind of, like I said, treating the symptoms instead of the root cause. But I even see this even amongst like friends and colleagues, right? They get really into like Vipassana and they go on a weekend workshop and then a week-long silent retreat. And then I had a friend who did like a 6-week-long silent retreat. And this is after like several week-long, silent retreats. And I was like, dude, you're engaged. You're like, you're trying to get married. Like, how is this affecting your relationship? And so I think the problem with sort of self-improvement in a nutshell is it's trying to improve the self, right? And from my perspective, which is a very act-informed perspective, there is no such thing as a self. The self is a story. It's a narrative. It's essentially a piece of fiction that we write, right, to convince ourselves that we are this static sort of entity. And ironically, you can improve your story, right? You are the hero in your hero's journey. And a lot of us essentially have created this narrative and be like, oh, I came from nothing and now I'm going to make myself into something. And so it's not that stories are bad. In fact, stories are traditional and they can be incredibly useful, right? But the problem is you are not your story. And that's the important thing to realize. And then one of the things that we literally teach and embody and act is that it's not that narratives are bad or stories are bad, but that when you overly identify with them, you literally think that story is you, versus it's just a change of clothes. It's a different suit that you put on that can be helpful. So an example of this is, right, when I'm working in a clinical context, like when I literally go and work in a hospital or used to work in a hospital, I would literally put on a white coat, right? Because it would give you this air of doctor authority when you're going and seeing patients that embodies you with sort of, respect and authority, which can be used, obviously, if you're doing it ethically in a positive way, because you don't have to sit there and like convince people about your opinion because it comes with that gravitas, right? And so, but I know that I'm not that thing, right? It is a suit, right? It's a role, it's a persona that I put on that's useful in the context of, helping someone. And then I take it off and I go home, and I'm not going to be the expert authority at home with my significant other, right? That would probably not be as helpful. And so it's very helpful to be able to put on, just like you're changing outfits for different environments, your sense of self or your sense of story to be flexible and adaptive to whatever the environmental needs are. But no matter which suit or which story or which narrative that you have about yourself, it's not you, right? And so no matter how much you try to improve that, right? You're like decking out your suit with a better tie or a nice little pocket square or whatever that you're doing to improve your story, realize that it's just a piece of fiction, right? So just as you're writing a story, right? You may be writing the great American novel and you're editing it and you're trying to make it constantly better to reach sort of the heights of Hemingway. In the end, it's a piece of fiction, right? And so that's the problem with sort of self-improvement, is this constant striving to improve something that which is completely made up in the first place. And in the end, if you're going to face your own mortality, there's a complete self-destruction at the end anyway. You're fighting this Sisyphean battle to roll this boulder uphill, knowing that it's all going to go to waste, right? Like if you think about the irony of men going to the gym, building as much muscle as possible, which I do, right, myself, but in the end, you know that your muscles are all going to waste and you're going to turn into dust in the end, right? So there's a sort of a sad tragedy to the whole thing. It doesn't mean that it's not worth doing and you should fall into nihilistic despair, which is kind of actually one of the themes of Fight Club, which is, you know, fighting the tide of emasculation and nihilism in a postmodern consumeristic society. But I think we do that because it's sort of an exercise in leaning into pain and suffering, right? When you go and destroy yourself in the gym, I would actually argue, yes, it's kind of self-improvement, right? It's improving your body, which is this fleeting thing, this fleeting vessel that's going to come and go. But it's also really an act of self-destruction. You're literally destroying your muscle cells in order to make them grow bigger. But I think it actually plays a bigger role psychologically in that you're sort of destroying, your ego. You're destroying your resistance to pain and suffering, and accepting the fact that essentially pain and suffering is a normal part of life. It's a normal part of existence, right? Which is very different than going to a weekend wellness workshop in Bali in order to feel better, right? When you go to the gym and you're like, you know what, I'm going to feel pain. I'm going to lean into pain. And it's good practice because I know life is suffering, and my ability to face towards pain rather than face away from it and avoid it is a useful skill to develop. So that's why I actually think that you should be careful about getting too into self-improvement, because are you really solving your problems, or are you actually using it as a sort of a ego-driven way of actually avoiding your problems? And so that's why, you know, even folks like Francis Weller, who's a psychotherapist that I admire and respect, when he does sort of workshops about grief, he's like, you know, lay off the self-improvement for a weekend, right? The goal here is really just to like accept yourself and acknowledge that you're worthy. So that's sort of my unpopular opinion for the week is, yes, we should be striving to grow and change and improve, but be wary of too much self-improvement. And I think in a lot of ways, self-destruction may be sort of a useful antidote to that. Because the irony that I see is the people that I know that are really into self-improvement are the people who need it the least. They actually need a lot more self-love, to be honest. And the people who are not into self-improvement are the ones who need it the most, right? So that's kind of the beautiful tragedy of life, right? The people who are like the people, you know, the marathon runners, triathletes, meditators, yogis, they're the people I feel like they actually need to lay off the self-improvement and just accept themselves for who they are. And it's the people who are doing nothing. They need to get their ass into the gym and meditate and do all those other things. So I would say, you know, as the Buddhists say, find the middle way. And if you find yourself overcompensating on self-improvement, you never feel good enough. You never feel worthy enough. Maybe you should add a little self-destruction to your life. So that's my point of view for the week.
Okay, we got this question from Discord for Dr. Cam. I'm curious to hear your take and tips on how men can maintain a strong frame in a long-term relationship.
Yeah, it's a great question. So let me talk a little bit about relationship dynamics from a psychotherapeutic perspective. And I learned this when I'm sort of getting trained in couples therapy. And I think it's an underappreciated thing. Men and women have different roles in the pursuit and development of relationships, which is important to acknowledge. At the beginning of relationships, men are the chasers and women are the chasees, right? Men generally ask women out and they pursue the initial sort of courtship, right? This is why apps like Bumble are quite frankly dumb, because women are not used to initiating. They're not good at initiating, quite frankly. They just say, hey, what's up, if you've ever used apps like that. Versus men, they are a lot more creative about it because they know your opening impressions, first impressions really matter, right? And so men are the initial pursuers in a relationship, and women basically hold the gates to sex in terms of they decide essentially when physical intimacy is initiated, right? Because men, generally speaking, for most men, I would say, who have normal, healthy libidos, would like to pursue physical intimacy if they're obviously, interested in dating someone. And women essentially are the people who decide. So they're the gatekeepers of sex, essentially. Now, what happens is when that threshold is crossed, the physical intimacy is achieved, and both partners sort of like one another. There's an interesting dynamic that sort of happens in a relationship in which there's a flip-flop, in which the chaser, which is the woman, becomes the chaser, right? Because what happens is like, okay, the guy kind of got what he wanted, at least in terms of the initial physical intimacy. It doesn't mean that that's all men want. But what happens is that men are the guardians or the gatekeepers to commitment, right? And so what women start to chase after is like, well, you kind of got my, the access to my physical and emotional intimacy. I want commitment and stability from you. And that's where guys are like, oh, okay, I don't know if I'm ready for that, right? And so the woman starts chasing, and then the man becomes the chasee. And that is the normal sort of trajectory, right? Just as Joseph Campbell talks about sort of the hero journey in your life, that is actually what happens in the normal course of courtship that happens. Now, this is an important kind of, it's almost like a play, like you have to kind of go through this sort of act. And there's a mutual exchange that happens, right? In which the woman is like, okay, great. I think you are worthy enough for me to risk literally my health and pregnancy in order to be physically intimate with you. And then the same thing, the man has to basically risk giving up his other options in order to be in a stable, monogamous, committed relationship. And so there's essentially a fair exchange, but we're gatekeepers of different items. Now, it doesn't mean obviously that there are certain times when men are the choosers and women are choosing, relationships as well. But that's the normal sort of gender traditional sort of course of the relationship. The challenge I think that men find in terms of maintaining their frame is when that reversion sort of happens, right? Men often have a very strong frame in the initial courtship phase because he is like the peacock in which he's trying to attract the woman by being like, look, I'm worthy, I'm attractive, I got status, I have resources, I'm funny, I'm charming, all these sorts of things. And so they're putting on, as we were talking about earlier, this narrative, right? And it's a bad thing or it's necessarily a falsity, right? But you're kind of putting on your best clothes, right? Like when you're going on a date, you're not going to wear your scrubby sort of hoodie. You're going to hopefully put on, nice outfits so that you can be like, okay, this guy, he knows how to groom himself. He can put together an outfit. It looks like a handsome sort of man, right? And that's sort of the courtship ritual that we get into. And so men often have very strong frames at the beginning of the relationship. But what happens is when they kind of get what they want initially, right, which is the physical intimacy, and then the reversion starts to happen where the woman starts to chase them, they start to lose their frame a little bit because they're like, well, I kind of got what I wanted, and now I'm almost running away, right? And now I have to be convinced about why is this woman worthy for me to not hit it and quit it, so to speak, and actually stay and commit to sort of this person, right? And so I think the important thing in order to maintain that frame is obviously there has to be an assessment on the part of you is, is this someone who is worthy of obviously commitment, right? Because if they are, then you have to sort of maintain that frame. Because if your frame is what got them, you can't sort of like take off that suit, you can't take off that narrative and not be strong, right? If you came off as a very strong, confident, go-getter, that's obviously attractive to a woman. And then in the context of relationship, you're like, okay, I'm going to let off and I'm going to, be very insecure. I'm going to tell her about all my problems. It's not that you can't sort of emotionally disclose, but there's a time and place for all that. That's going to sort of turn her off and you sort of switch the frame sort of completely, right? Now, there is obviously an evolution that happens in the context of relationship in which emotional intimacy develops. You can be more vulnerable. You should share some things, obviously, with your partner. You don't need to be like so perfectly put together all the time. I actually argue a lot of times perfection is boring, quite frankly. If you come off as too perfect, you don't seem human to your partner. But the thing is, you can't destroy the entire frame in which you walked into the initial courtship and then totally become a different man, right? I think that's like too disturbing for a woman and also for you, in that you're almost like you put on a completely different suit of clothes once you kind of got what you wanted. So that's the first thing I would say is you have to think about it as like, okay, if I think this woman is worthy of a relationship, I'm still courting, I'm still dating, right? Her, in that even though I am the chooser, right? I'm deciding whether to commit to this relationship and stay committed to this relationship, there's almost an equality that's sort of reached in the relationship where you've kind of gotten, each of you as the gatekeeper, what you wanted, and you're like, great, now we're together. Let's build something greater than the each of us, right? So there should be a synergy where 1 + 1 = 3, and we're better together, right? So there is almost a new frame that needs to develop, which is, it's not that, okay, great, I'm the perfect looking peacock that needs to convince you to sleep with me, and she needs to be like the beautiful dove that convinces you to commit to her. It's like, okay, great, now you're the dove, you're the peacock, you've decided to get together, you're both worthy, and you need to maintain some new frame, essentially, that gets you to stay together. So I think the important thing is to not be complacent, even when you've both made that commitment to one another, and you're like, great, we're boyfriend, girlfriend, maybe even we're engaged, maybe even you're married, and you're in the context of a long-term relationship. You still need to try, and you need to still uphold the things that initially attracted you to her. And if that is sort of confidence, if it's decisiveness, if it's the quality or humor or whatever is the qualities that initially attracted you to her, that frame needs to be sort of maintained long term. So I would say don't get lazy, don't get complacent in your relationship. You shouldn't think about just because sort of you got what you wanted or she got what you wanted that essentially courtship is over. I think even though you are easing into a relationship and you're maintaining that long term, you're still dating. You're still dating forever. I think, in fact, there's couples I know who have been married for decades. They still go on date nights, right? That's how you keep the romance alive. So just as you're doing that in a ritualistic way by going out every Thursday or Friday on a date night, you need to also maintain your frame, that narrative, that suit that you put on, in order to, keep the attraction alive. So that's what I would say in terms of maintaining frame. So this is kind of an interesting story. I don't know if this person's listening in, but if you want to chime in, I'll just sort of verbally recount sort of the discussion that we had earlier today. This was a 29-year-old guy who was reporting symptoms of low testosterone. So he actually had a lab test done. Said his testosterone values were 245, which is actually below normal, right? So usually like reference ranges around 295, 300 is considered the lower end of normal. That's kind of like 2.5 percentile. So if your total testosterone is 245, you're basically at like the 1 or 2 percentile. So you're very, very low. And he was like, my doctor's like, that's actually low enough to qualify for TRT or testosterone replacement therapy. Should I do it? And I was like, well, listen, that's a decision for you and your doctor to make. I'm not going to give you medical advice about that. But let's just try to figure out what's going on, right? I was like, what are your other lab numbers? And also, like, what's your lifestyle, right? Like a 29-year-old shouldn't have testosterone in the 200s. Are you sleeping? Are you exercising? Tell me about your life. And he's like, my sleep is great. I'm a tall, healthy guy. I'm not overweight at all. I work out 4 to 5 times a week doing sort of HIIT training, do body weight stuff 3 times a week. Was in the gym 6 days a week before the pandemic, put on 20 pounds of muscle. And I was like, this guy seems really on it in terms of his lifestyle. His testosterone shouldn't be in the 200s. And when we were digging in a little deeper, he's like, oh, I also was on S.A.R.Ms the whole time that I was working out. That's how I put on 20 pounds. Because I was like, 20 pounds of muscle is not sort of a normal amount to put on unless they're sort of newbie gains, meaning you've never lifted weights before in your life and you're doing it for the first time. So for those of you who are not familiar, S.A.R.Ms are selective androgen receptor modulators. They're kind of like the new steroids, if you will. They are research chemicals. None of them are FDA approved, but they're going through clinical trials right now for various like muscle wasting conditions and disorders. And they're very essentially potent androgen receptor agonists, meaning that they bind to the androgen receptor just like testosterone and anabolic steroids do. The difference with S.A.R.Ms is that they're selective androgen receptor modulators, meaning they bind selectively to certain receptors in areas like the muscles, which is exactly where you want it, right? Because you want the muscles to grow, but they don't bind in areas like the prostate, where you don't want the prostate to grow as a male, because you're going to get BPH, enlargement of the prostate, and you get trouble urinating and potentially risk prostate cancer. And so they've designed almost these sort of molecules to be the best of both worlds. You get the the anabolic benefits in terms of muscle growth with less of the androgenic side effects in terms of like excessive body hair growth, BPH. So anyway, this guy was taking them. By the way, S.A.R.Ms are illegal and they're underground, right? So when you buy S.A.R.Ms, you're getting them from God knows who, from, you don't even know if they're S.A.R.Ms, you don't know if they're legit, you don't know if they're pure, you don't know if they're adulterated with other chemicals. Who knows? It's very risky. That's why I'm not a fan of either steroids or S.A.R.Ms that are not prescribed by a doctor, because who knows what the hell you're taking? I think it's a bad idea to take chemicals. Anyway, so this guy was taking, there's a S.A.R.M called RAD 140 and another one. And I was like, well, how long were you taking these? And he's like, well, my personal trainer had me on it for 8 weeks, and then I would take a 3-week break, and then I'd repeat this for a year and a half. And I was like, oh man, like, I think I know why you're potentially suppressed. I was like, for most people who are not familiar, when people go on sort of S.A.R.Ms or steroid cycles, they're only usually doing it for 8 to 12 weeks at a time, because it's tremendously suppressive, meaning it shuts down your own natural production of testosterone. And it can often take weeks or months to get back online by doing what's called a post-cycle therapy, or PCT. This is what bodybuilders essentially do when they're getting ready for shows and stuff. But the thing is, they usually do that like once, right? And then people will go off for a while in order for their natural levels to replenish. This guy was going on for 8 weeks, 3 weeks off, 8 weeks, 3 weeks off, doing this over and over again, where I was like, I don't think his HPTA axis was ever coming back online, right? And so he was basically probably suppressed for an entire year and a half, is my speculation. And it shut down his endogenous production. His testicles probably literally shrunk, and his HPA axis basically went offline. So it's almost like, imagine that you haven't driven your car in a year and a half. The battery is going to be dead, right? And there's probably no saving that battery. You probably need to replace the battery. And so I was like, look, this guy can go on TRT, but he should look into, there are ways of sort of, like I said, doing this post-cycle therapy that can stimulate your own natural production. We do something like that essentially in Maximus Tribe, if you're interested in our protocol. But I think the lesson from that guy and that story is be very wary of taking anything sort of suppressive long-term, because if you do, it probably will affect your long-term production. When we talk to our medical advisors, they're like, people who've been on TRT or steroids for long periods of time, their system is never basically the same long-term. Even when they come off of it, you can't expect them to respond to something like our protocol, like someone who's essentially like a virgin to sort of drugs. And so unless you're making the long-term, lifelong commitment to like, I'm going to be on TRT forever, and I don't care that I'm shut down because I'm going to basically be using it till I die, just like a type 1 diabetic uses insulin for the rest of their life. I don't think it's a great idea to play with these things, especially for like more of these medium term, like even a year and a half, because it can shut down your natural production. And this guy, it's hard to tell, because I asked him, I said, did you measure your testosterone levels before you went on S.A.R.Ms? He said no. And unfortunately, not a responsible thing to do, because you should always measure your blood levels before you start any sort of drug or treatment, so you at least know what your baseline levels are. Because now it's hard to tell. Is it because, I don't know, for other reasons or genetically this guy's low testosterone, or environmentally because of toxins, or is it because of his S.A.R.M use? Because he doesn't have that baseline value, we will never know. But I would say, just given the whole sort of story, I would say Occam's razor says the simplest solution is usually the right one. In this case, someone who obviously abused, anabolic, drugs for a year and a half probably suppressed his system. Now, it may be remediable through proper medical supervision and care. I hope it is for this guy, and wishing him well. But lesson learned is, like, your personal trainer is not a doctor. Probably has no idea what he's doing. Who knows if what the hell he's giving you is actually legit. And he's not going to put you on a protocol that's going to be set you up in the right way. There may be a world in which in the future, like, S.A.R.Ms can be used sort of safely and responsibly. They probably do need to be taken with some sort of, base that prevents the suppression from happening in the first place, I would say, whether it's TRT or a S.A.R.M. But that's really why it needs to be supervised, right? You need to be lab testing really frequently. You need to be making sure it's not messing up your lipids, which S.A.R.Ms can do, making sure that it's not messing up your SHBG, which it can suppress, making sure it's not messing up your liver values. All these things sort of get affected long term. And quite frankly, unless you're very, very meticulous and maybe you're like very scientifically oriented, most people aren't, just don't know what they're doing, even if they are smart people, and they kind of make kind of rookie mistakes like that. So I would say, unless you're doing it under doctor's supervision, I don't recommend, being your own doctor, or drug dealer to yourself, because you eventually run into situations, sad stories like these. So yeah, I would say buyer beware.
Follow up to the topic of testosterone. Speaking of testosterone optimization, what kind of physical or psychological changes have your patients on the Maximus protocol experienced so far?
Yeah, great question. The funny thing is, the unfortunate thing is people sort of confound testosterone optimization, or we call it testosterone maximization, with anabolic steroids. Anabolic steroids and SARMs are just in a totally different category of drugs. The difference is that testosterone optimization or maximization will get you from what I call sort of average levels or even low levels to alpha levels, meaning you can go from sort of being in the second to, 50th percentile, so you're kind of below average, and they can get you to the 80th to 99th percentile, right? But it's still something that's human, right? You start to look like an athlete, or what an Olympic athlete would look like, who has high testosterone levels. But it's still within the normal range, and that makes it sustainable forever, basically, right? As long as like I said, your liver values and everything else is healthy, which, in our protocols, it doesn't even affect the liver in any sort of negative way. There's no adverse effects based on the clinical literature. It's something that you can take long term. Anabolic steroids, however, it's not like you're getting your testosterone to 1,000, which is kind of the upper end ish of the range. They're getting you to like 3, 4, 5,000. Which no human being on earth has testosterone levels that high. That's why it's not sustainable. That's why steroids are cycled. That's why they only do it for 8 to 12 weeks, right? So the problem is people look at steroids and they think, oh man, if I take steroids, I'm going to put on 10 pounds in a month, right? And that's what, unfortunately, people associate with sort of testosterone. Yes, testosterone does drive muscle growth and fat loss, but it's only at those super, super physiological dosages that you see this, or like the bodybuilder-like sort of effects. If you're just taking like therapeutic, like hormone replacement therapy dosages or testosterone optimization maximization dosages, your testosterone is just going to look like a fit guy. And that means you're not going to gain a huge amount of muscle or drop a huge amount of fat just by virtue of taking a drug. It will help, absolutely. But we're talking about like a few pounds, right? Not 10 pounds or 20 pounds where it's like a drastic difference. And the difference is, like, by the way, if you're familiar, like, you can always tell when someone's juicing, right? Like when I look at these Hollywood actors and they're like, oh, I had a body transformation, I put on 10, 20 pounds in like 2 months. I was like, it's just not humanly possible, right? Without drugs. Versus, if you're optimizing your testosterone, you'll put on muscle, but you'll put on muscle just like a D1 college athlete puts on muscle, right? You'll be enhanced. You'll be able to do it, but it's going to look natural. It's going to feel natural. It's not going to be unrealistic. You're not going to stretch marks because you're growing it so quickly. So I actually think the muscle and fat benefits are, while they're beneficial, it's not even the best reason to optimize your testosterone. I actually think the best reason is, ironically, it's much more psychological than physical in terms of the benefits of testosterone. Okay, so here's the interesting findings in this study. They actually found decreases in anger. So as opposed to the roid rage stereotype, they actually became less angry. They became less irritable. They became less sad. They became less nervous, so their anxiety went down. And their fatigue or their tiredness also decreased. To me, that's actually the number one, by the way, benefit of high optimal testosterone levels is energy. Right? And it's a very natural energy. It's not that disgusting caffeine stimulated, you're nervous and jittery kind of energy, which I hate. I don't even consume caffeine, by the way, because I think it ramps up my anxiety and it's uncomfortable. But I'm talking about it feels like you got 9 hours of sleep, you're well rested kind of energy where you're like, I feel like I can take on the world. That's the kind of energy that testosterone gives you. It's a natural kind of inside out sort of energy. And it is inside out because caffeine, which is an exogenous drug that you take that's like, hitting your adenosine receptors. This, in our protocol, while we are also using a pharmacological agent, it's indirect in that it's stimulating your own testosterone. And so the energy that you're getting is coming from your own testosterone levels. It's not directly coming from an exogenous drug. The interesting findings from this study is that people were more friendly. So this is like totally counter to like the really tough guy testosterone stereotype that people have, which if you think about it in a lot of ways, it actually makes sense. Think about the guys who you know are naturally like high T or alpha, right? It's almost like it's the strong, silent type. They're naturally confident. They're not like the arrogant, narcissistic, trying so hard kind of guys. Because they're like, look, I'm strong, I'm confident, my life is together, I look good, I feel good, I don't need to run my mouth, right? And so as a result of that, they tend to be friendlier. As I mentioned, the energy levels go up and the general overall sense of well-being has gone up. So, the interesting thing is, the conclusion that I got from reading this study is that basically, if you think about testosterone as a marker for masculinity, hypermasculinity or high testosterone is basically warm, right? It's not cold, it's not arrogant, it's not brash, it's not gym bro or bodybuilder stereotype. It's actually like, think about a fit father is like kind of the analogy that I would make. It's like someone who is strong, but is very warm. It's like very caring, is comfortable in his own skin, has a lot of energy. Testosterone increases confidence, risk-taking, and drive as well. And so it makes you want to approach challenge a lot more than when you're low testosterone. So when you're low testosterone, like trying anything just seems hard. It seems effortful, and you just want to, just like how we're talking about avoidance, you kind of want to stay away from it because you're like, I don't like feeling uncomfortable. When your testosterone's high though, you're like, you like challenge. You're like, this is going to be hard and I like it for that reason, right? You're like, bring it on. It's that kind of ethos. And I think it's a lot more subtle. It's like I said, testosterone, it's not a typical psychoactive drug. It does affect the brain, but it's not psychoactive in a way like a caffeine or an amphetamine is. You don't take it and you feel like this immediate high. It's a much more subtle thing. This is actually literally from this morning, 11 o'clock. I'm feeling great lately, driven, focused, calm, and imperturbable. I love that word, by the way, imperturbable. Another one of our users actually also from this morning said, he was benefiting not only from the pharmacological aspect of what we're doing, but we put people as part of our protocol into online groups. They're kind of like accountability groups. And so he was talking about, this has really been a great forum for accountability and leveling up. My sleep's better, my testosterone's better, and the focus on my relationship will make that better because we're working through some relationship stuff as well. Those are, I think you should think about it holistically, right? It's not just like, what are the benefits of high testosterone, but what are the benefits of being on a program or a protocol that uses testosterone as the primary marker. I always argue basically testosterone is the best. Like if you have to pick one marker to assess your health, to me, testosterone is it. Because it's not that it's the only marker that matters. You should look at a lot of different markers in my opinion. But if you had to pick one and just keep it really simple, testosterone is basically how you know you're doing it right. Because if your sleep is right, your exercise is right, your diet is right, you're taking the right medications, you're taking the right supplements, your focus is good, you're having good sex, your relationships are on par. That should be reflected in that number, right? Your testosterone should be high. And so it's a very useful, almost like, if you make a video game analogy, it's like your high score, right? You know you're doing it right because the points are racking up, your testosterone's high. So I think it's a very useful thing to look at, and it's a useful thing to optimize because you're like, if it's beneficial to my health, generally it should be pushing my testosterone up. That's how like diets like a vegan diet, which lowers testosterone, is clearly not healthy, right? Because think about it this way. Your biological purpose is what? To reproduce successfully, right? As a human being, as a man. I don't think there's any argument from a Darwinian perspective that's true. And so basically anything that drives up LH and FSH, LH drives up testosterone, FSH drives your sperm count, right? And your fertility. So any behavior that you're doing should be increasing your testosterone, increasing your sperm, because that increases your reproductive fitness and your success essentially as a member of the human species. And so that's why it's very useful to look at it as a marker, in that anything that's health promoting should increase essentially fertility and reproductive capability. anything that's sort of not good for your health, alcohol, veganism, all these things are suppressive of fertility, and you should obviously minimize it to a large degree. So hopefully those are sort of useful lessons about why I think testosterone is the best biomarker, in my opinion, of sort of male health in general. And it's a useful sort of guidepost or North Star in terms of whether you're deciding any behavioral intervention, any pharmacological intervention, is it pushing you in the right direction or the wrong direction when it comes to your health? And that's why it's useful to look at and measure. Hey, Greg, how's it going?
Good. This is a follow-up question. Does it help with like ADHD and like, doing kind of your program? Does it help? Because you said that it helps with focus, and does it help with the ADHD?
That's a great question. And to be honest, I don't know. And I'm actually going to go look up the research literature on this after this show. Because I want to give you an answer that's not evidence-based and research informed. Because there's a difference between just like attention and focus and ADHD, right? Where obviously there's a disturbance in an ability to focus, particularly if you're ADHD inattentive subtype. But it's more than just like a normal inability to focus. There's probably a dysregulation of the dopamine system in ADHD, where you're literally driven to distraction, right? Where if you think about ADHD as a sort of this is oversimplistic, but a sort of a dopaminergic system deficiency, right? You'll seek out things that increase your arousal, and that's why you're attracted by shiny new objects, right? It's hard to like sit there and clean your room because it's stupidly boring. But playing a video game or reading a really interesting book or watching an engaging movie, you can focus on that fine if you have ADHD, because it's stimulating sort of your dopamine system and getting you up to the level that you want. I do think there is an association between testosterone and dopamine, but I don't know specifically in the context of testosterone optimization and maximization, does it improve ADHD symptoms? That's a great question. So I will look up the research literature on that. I don't know of it being used explicitly for that purpose. That would be like an off-label use, essentially. There's no, testosterone boosting drug that I know that's ever been used explicitly for the treatment of ADHD. But of course, there's people who have ADHD and hypogonadism, and it'd be really interesting to see if treating one essentially improved the other. It's a great question. What I can say though is, it may improve some of the things that make ADHD worse, right? So for instance, there's a comorbidity between ADHD and anxiety. People who have ADHD often have anxiety as well. And this makes it doubly bad in terms of procrastination, right? Because ADHD makes you want to procrastinate, as I mentioned, because doing low stimulating activities is like pulling teeth, right? It's literally boring. It's painful for people with ADHD to do. And then if you have anxiety on top of that, and you have anxiety about the task, about doing it right, about perfectionism, now that makes it twice as hard. As I mentioned, the study that I specifically cited before did mention a decrease in sort of nervousness and irritability and an improvement in terms of fatigue. And so if your anxiety goes down and your energy levels go up, then if the anxiety is exacerbating your ADHD, it should help with that. And so it may make some of the things that make ADHD harder or worse better. I don't know if it's specifically like improving dopaminergic function in order to improve attention, but I'll look that up, and it's a great question.
How you doing? So this kind of feeds into what you were just talking about. In one of your tweets, you mentioned that the hormone oxytocin is synergistic with high levels of testosterone. I was wondering, if you're low in oxytocin, could that potentially affect your testosterone levels? And if so, is there a test to find out whether or not you're low in oxytocin similarly to how somebody might be low in testosterone?
No, it's not typically tested like it is. The thing is, the question is like, could you test for it? Yes, you can measure levels of oxytocin. The problem is with certain hormones. So oxytocin is a hormone like testosterone. But testosterone has kind of a diurnal rhythm. It's highest when you're sort of sleeping at night and early in the morning, and then it kind of drifts during the day, increases during the evening. And so there's a nice little rhythm to it. overall, testosterone is relatively stable, even though it fluctuates a little bit during the day. Like, for instance, if you test your testosterone levels at the same time in the morning, right when you get up, which is the way that you typically do it clinically, right? You get someone to like, 8, 9 in the morning, you go test your testosterone levels. On a day-to-day level, it's actually pretty consistent, right? Assuming all the other variables are consistent. You're sleeping the same amount, you're eating the same. It should be pretty consistent. There are other things though, like for instance, if you take growth hormone is released in a pulsatile fashion. And so really it's actually a very, very volatile. And so it's actually not useful to measure growth hormone, even though you can, like technically you can measure it, but it's not useful because you don't know if you caught it at the top of the spike or the bottom of the trough. That's why instead of measuring growth hormone, they measure something else, which is IGF-1, correlates with growth hormone, but is much more stable. I believe, if I'm not mistaken, the oxytocin is the same way. Oxytocin can be released in a huge spurt. Like for instance, when you orgasm, your levels go up like they on like a multiple of sort of factors. Obviously, if you're doing anything that's pair bonding related, you're hugging your partner, you're engaging in physical touch, you're engaging in massage, your oxytocin levels are going to spike. And so because of that and the volatility of it, I don't know any clinician that measures oxytocin actually. And so it's hard to tell if you have sort of an oxytocin deficiency, like in the same way that you do with testosterone. Now, there is associations with oxytocin dysregulation and autism spectrum disorder, which is really interesting, right? Which is, as not surprising, people with sort of autism have deficits in sort of social interaction and empathy.
Social interaction,
and also have a lot of social anxiety as well, which oxytocin improves. That's why there's a bunch of clinical trials, in fact, that have tested different forms of oxytocin for people on the autism spectrum. And there's some, I think, interesting preliminary and promising results that it may be sort of helpful. So I would say, it's very different. I don't think people in the same way, like with testosterone or growth hormone, you test it, there's a deficiency, and thus you treat it. I think it's oxytocin is a lot more of in kind of the enhancement role. Well, maybe let's say if you have a diagnosis, right? Like if you have autism spectrum, you could, in an experimental off-label way, work with a clinician in order to treat that. But I think for the majority of people, the reason that they would sort of take oxytocin is that it's really a sexual enhancer, is the way that I'd put it. PDE5 inhibitors like Viagra and Cialis, which people may be familiar with, increase vasodilation and blood flow to the penis, which obviously improves your ability to have and maintain erections. The thing is that people don't understand is that just because you have better erections does not make sex better. It just means you have a harder penis, which if you don't have problems getting erections in the first place, like a slightly harder penis, if it's can get even harder than a healthy erection, is not going to make sex better. Oxytocin, though, on the other hand, is very synergistic, not only with testosterone, as you were asking about. I actually think it's very synergistic with the PDE5 inhibitors in the sense that what oxytocin does is it doesn't increase sexual performance in terms of the strength of the erection. It increases sexual enjoyment, right? So the pair bonding, like the emotional experience of sex, like being really into the person that you're having sex with, feeling a sense of connection with that person, is enhanced with oxytocin. The other thing that's very interesting about it is it enhances the strength of the orgasm. So if you're trying to enjoy that in the sort of the penultimate, obviously, climax of sex, it makes it stronger and longer for men. In a way, it's kind of cool because women, men should probably be jealous of women in a lot of ways because they have better orgasms than we do. They're definitely longer and stronger, and they can obviously have multiple orgasms as well. But oxytocin, in a way, is kind of a cheat code for men in that it won't give you multiple orgasms, but it will give you longer and stronger orgasms. And so that can be obviously very enhancing. The trick about oxytocin, though, is it has a very short half-life. So like the intranasal form, I think it only lasts like 15 minutes. And so you have to like take it right before sex, basically, half of the bottle like lying around in order to do that. That's why I'm actually a bigger fan of the sublingual form. Even though the bioavailability is unclear, the nice thing about it is you can take higher dosages of it. Oxytocin is relatively safe. And it seems to last longer when you take it sublingually, like under the tongue, or letting it sort of dissolve there's sort of these oral dissolving tablets that you can take in your mouth. At least anecdotally, clinically, I don't think there's a ton of research on this yet. It can last sort of longer. It can last like more on the order of hours. So even though, you know, the bioavailability may not be good, I don't know what's being absorbed, let's say somewhere between 1 and 10% of it, you can take 10 times as much as you would intranasally. So intranasally, you may only take, let's say, 10 IUs. Orally, you may take 100 IUs, right? So you're taking 10 times as much. Because you know that the bioavailability is low, only 10% is being broken down. Net, it amounts to the same amount, right? So only 10% is being absorbed, but you get to that you get to that effective dose. That is wasting a little bit of it, but I think it's not super expensive or rare. So I actually think it's a smarter strategy going forward. And I think you're going to see more and more of sort of these sort of oral sublingual oxytocin that's used both for sexual enhancement, like I talked about, and also for social enhancement in terms of relationships.
Social, that'd be really, yeah. And also another question I had is do you know of any instances of people taking too much of this stuff or developing dependency or addiction problems with it because maybe they like the feeling too much? Or
I've never heard of it actually. I'll dig through the research literature to see, but the pharmacology of it, is not prone to addiction. You know, like I said, hormones are just hormones in general are not very addictive. Like even testosterone, the problem with TRT is like I said, it shuts down your own production, but people don't get addicted to it. Like there's no withdrawal that happens from testosterone. It's just that your body shuts down. If your body actually didn't shut down, or you took something that was an alternative to it, you know, there's no like testosterone withdrawal symptoms. It's the same thing with melatonin. In fact, you know, melatonin is very safe as a drug. In fact, that's why people overdose, in my opinion. Not overdose literally in terms of harmful side effects, but they take doses that are too high. Now, what that may happen is just like testosterone, it may suppress your natural melatonin production. I was actually talking to someone who was taking 10 milligrams a day, way too much. Like your body produces like 0.3 milligrams a day physiologically. And he found that when he stopped taking it, he was having insomnia. And so I was like, okay, well, work with your provider. You probably need to taper off of it and re-stimulate your own natural production. So that's the only concern that I would be theoretically aware of, is if you're taking super high doses of oxytocin, would it suppress your natural endogenous production like these other hormones? Unclear, right? Because there's not a lot of studies, like people use it a lot more as needed, rather as opposed to like a daily sort of thing. But I think if you're taking reasonable dosages of it, I haven't heard any, at least clinical or anecdotal examples of any sort of like addiction or withdrawal. Like I said, hormones tend not to be super addictive in the first place because they're not directly psychoactive. But B, I think if you're taking reasonable dosages, which if you're prescribed by a doctor, obviously you would be, it wouldn't necessarily mess with your own natural production, hopefully, too much. So thank you for joining us. We'll be back every single Thursday at 6 o'clock Pacific time. If you submit your questions in advance, I'll prioritize them. And obviously if you ask them live, I'm always happy to, chat through those issues with you. So thanks everyone. Have a wonderful rest of your day.